Hello, everyone. Good morning, good afternoon. Welcome to the webinar on financing of social assistance in Africa. My name is Renata Nowak-Garmer, and I'm the Social Protection and Employment Specialist for UNDP Africa, based in Addis Ababa. It's my pleasure to introduce you to the panelists today. The first speaker and the panelist is Gift Dafuleya. Gift is the lecturer at University of Venda and research associate at the Center of Social Development at the University of Johannesburg. We also have a privilege to have Saurabh Sinha with us, who is the Chief of Employment and Social Protection at UNECA in Addis Ababa. So this is the first out of the 3 seminars that we'll be conducting together with socialprotection.org. We would like to look at the findings of the recent report released last year, the State of Social Assistance in Africa. The first seminar will focus on the issue of financing, which is extremely crucial and extremely timely. The whole I think that the new context, that the new normal, which is the context of COVID-19, has really underscored the importance of sustainable social protection, of comprehensive systems. Even though countries are trying to now, most countries in fact, trying to patch up assistance with different subsidies, short-term measures and emergency grants, this report argues for sustainable and systematic welfare architecture in countries. And I think it's now really the time to advocate and push for it. Just a little bit of background. The report was done by UNDP in collaboration with the African Union, with the ILO, UNICEF, and UNECA. And the 2 presenters here will be, as mentioned, discussing financing. But the other 2 aspects, and absolutely crucial also for any social policy, are legal frameworks, which we will discuss, I believe, next month, so stay tuned for that, as well as institutions. What are the institutions that the countries put in place, whether they are capable of implementing their mission, whether they have procedures, rules, and so on to carry on. But again, I followed many webinars on this space, and here the crucial issue now that we will focus today on is financing, and the 2 presenters have co-authored the chapter on financing and will walk us through the findings. So first, in terms of the trends, I would like to invite Gift to please talk to us for about 15 minutes. Each presenter will have 15 minutes to make the presentation. So Gift, after that, sorry, let me do the housekeeping also. After that, if you have specific questions for the presenter on his presentation, we can take those questions. Otherwise, please hold the questions, but register them on the chat, and we will have a 25 minutes Q&A at the end. So Gift, over to you. What are the trends in social assistance in Africa? What is the funding gap? And how much countries commit in terms of paying for the poor, in terms of protection, social assistance? And if you can also frame it within the COVID context a little bit, we would all appreciate it. Thank you, and over to you.
Thank you so much, Renata. Good morning, afternoon, evening, depending on wherever you are. I would like to thank socialprotection.org for organizing this, and for UNDP for inviting me as a participant, as a speaker, actually. So I'm a teacher, and I will basically start by delineating what we mean by social assistance, as well as financing social assistance. So basically, social assistance is composed of three programs. That is cash transfers, food transfers, as well as public works. And we contend that these programs should be institutionalized, that is, they must be permanent. Emergency assistance, on the other hand, will actually constitute of food transfers, cash transfers, and public works programs that respond or that address a misfortune, and they target people affected by hazards. So we delineate these two in our database as we present this presentation. I will also move on to delineate the financing of social assistance. I'll call this the triple M paradigm, where we look at micro financing of social assistance, which deals with finance at a broader level, or even at a national level, should you like. And a good example will be the social assistance expenditure as a percentage of GDP. I'll also categorize meso financing, and this type of financing will be between macro financing and microfinancing. The microfinancing being the financing at a household or at an individual level. This conceptualization is important to keep in mind as I move on with my presentation. The arrows basically gives us an idea that if we start our microfinancing from the top, that is, if we take a positivist approach where we look at how other countries are financing their social assistance and how much of spending as a percentage of GDP they are committing to social assistance, then we sort of use almost the average to say then a country trying to do social assistance will also maybe put on a certain percentage that is similar to counterpart countries. So that then trickles down to give or inform the size of their SA or their social assistance budget. Perhaps that is mostly the practice now. But there is this normative approach that is also there, but is less dominant. The normative approach will actually go down to the micro financing part. That is to look at transfers per person that are needed, perhaps to take people out of poverty. And then these are escalated up to see how much we may need to spend as a percentage of GDP. So I will mostly take the normative approach in this presentation. And doing so, it will mean that I'll start by looking at the needs assessment of transfers per person in Africa. And the simplistic approach will be to look at the people living in extreme poverty in Africa. And most of the countries have got people who live in extreme poverty, and it needs $1 a day to $1.90 per day to take these people out of poverty. So once we've done this needs assessment, in this occasion very simplistic, we then say we take all the number of people who are poor, and then per day we give them $1.90. And by so doing, we're saying we'll meet goal number 1 and we've eradicated poverty. So this gives us a simplistic picture of the percentage of GDP required for social assistance at macro level. So there's clearly a connection that we don't need to underplay between micro financing as well as macro financing. Now, let us get a bit deeper on the macro financing part, and we see the picture of how Africa is faring in that regard. So the social assistance expenditure as a percentage of GDP for most African countries is below 1% of their GDP. Clearly, this figure is low compared to perhaps middle income or advanced countries. If you look particularly at Central Africa, most countries spend less than 0.05% towards social assistance. Now, sympathizers would like, it is very, very difficult for Africa to finance its social assistance simply because the budget deficits are the order of the day. Almost all African countries, save for a few, they run budget deficits. And then one would ask to say, where will this money to finance social assistance come from? I think looking a bit deeper on the composition of tax revenue in Africa is perhaps interesting and could give us some ideas of where money currently is coming from. If you look at the indirect taxes in Africa, that is your VAT, your goods and services tax, etc., you will find that they are the one that majorly contribute to the tax revenue in Africa. They are followed by the direct taxes, which compose of income tax as well as corporate tax. The resources tax, surprisingly, are a bit low. So now we've got a higher share of contribution from indirect taxes. And then the idea now is that if government spending follows tax revenues as a fairly direct way of funding its services, we should be expecting more transfers and services to the poor in Africa. Why? Because arguably the higher share of the poor's income contributes to indirect taxes, that is to your VAT. But this is not the case and this is not happening. But again, one would ask at this stage to say, why is Africa relying majorly on a tax system that is perhaps regressive? The answer is perhaps simple if you look at the composition of data amongst African countries. One, it is easy to collect $1 from VAT compared to collecting $1 from an income tax. So the cost of collecting an extra dollar from VAT is cheaper. If you look specifically perhaps at Benin, you will find that it takes 15 cents extra to collect $1 extra for consumption goods compared to collecting the same dollar using income tax, which will cost you $1.50. So it's sort of easy for African countries to use indirect tax of VAT to generate revenue. And now, if that is the case, let us then look at the microfinancing to say, if it's easy to collect VAT, which composes a higher share of income from the poor, how do we fare in terms of servicing the poor? So we look at the microfinancing part now. The trends are not so pleasing. They are very, very low. Like if you look at the highest spender on low spenders, they spend about $9 per poor person per year. the intermediate spenders would spend about $150 per poor person a year. And that is very low to think of lifting people out of poverty. However, we do have high spenders in Africa, and these would include your South Africa, Tunisia, Mauritius, and Seychelles. Now, I would want to also look at the financing per cash transfer in terms of donor and domestic spending. The pattern is interesting because if you look at the domestic sources of financing, each time the spending is tracked within the domestic financing, the average cash transfer per month that is given to the participants is higher than that of donors. Let me then move on quickly to the measure of financing, that is to look at the program budgets at this point. The project budget, the program budgets, they show that mostly it is the children, the old aged, as well as persons with disabilities that are targeted, and rarely do the poor and vulnerable youth get any target from the programs. And also, if you look at these program expenditures, the ones that are domestically funded, they constitute a higher average spend per year compared to those that are donor funded. Perhaps this is the issue because most domestic programs are not pilots, they are institutionalized and they are large scale compared to donor programs that are mostly pilot programs. So what are my takeaways from this? One, the triple M paradigm sensitizes us to take a closer look on fundamental issues involved. For instance, if we just go for macro financing, that is to just give a percentage of GDP required without seeing how that translates at a micro level, we sort of lose the picture. Then two, we can see that a lot of people, this is now at a microfinance level, they are still inadequately, they still receive inadequate transfers. Three, the poor adults and youth are not considered. And four, domestic funded programs have a higher reach and higher adequacy. And this takes me to the picture that is emerging out of COVID responses that have required domestic responses. So the responses have meshed the pattern in which social assistance is institutionalized in Africa. Countries that have social protection running for quite a long time were quick to respond after implementing lockdowns or curfew. And then countries that have not institutionalized social assistance were slow to introduce their emergency assistance. Perhaps the reason is they're not used to it. They're not used to funding from their own coffers. How is the journey ahead looking like? I think decisions will have to be made by countries to go for adequacy or reach. If you go for adequacy, we have been seeing targeting a lot, where we want to improve those that have been targeted to have adequate transfers. Then the reach is still low. We may want it to be high. That is, you institutionalize social assistance and have a high reach. So you need funding for that. But I think the talk should be mostly, let us finance to improve both adequacy as well as reach. I think with that, Renata, I would say thank you, and I hand over to you.
Thanks so much, Gift. That was very interesting, and thanks very much also for highlighting the current response and how that relates to the very institutions of social assistance in Africa. where the countries that have more established institutions are faster to respond. And a very important finding of the report that really is now extremely heightened by the current crisis is the fact that the working age, the poor working age adults, those who are in the informal markets, those whose livelihoods are now really endangered by the pandemic, have the lowest possibility of the smallest possibility of receiving transfers and having programs. So this is something we take note of as UNDP, hopefully, and other agencies can pick up on. The other issue, of course, that the report highlights is that yes, on average, the domestic financing is growing for this purpose, but still is quite inadequate, as you have rightly pointed. So now I'm inviting Saurabh, since I don't see any questions on Gift's presentation. I would like to invite Saurabh with $1 million or rather $1 trillion billion question on what countries actually can do, what are their policy options to increase the domestic financing, and whether there are any other options they might consider at this point, including increased aid or any other innovative sources of finance. Thanks so much, and over to you, Saurabh.
Thank you, Renata. Hello, everyone. I'm Saurabh Sinha. I'm the Chief of Social Policy section in UNECA. Okay, what do I do? Okay. Yes. Okay. Let me start now. As Renata has mentioned, I'm going to be talking about mobilizing domestic resources for financing social assistance. So in that sense, this presentation takes off from where Gift ended his presentation, and we try and see, we look and see what are the possible options different countries have, especially in Africa, to be able to raise domestic resources, which, as many of you would recall, is a very important component of the Addis Ababa Action Agenda, where the emphasis is on the countries themselves to raise domestic resources, mobilize resources for funding the progress on SDGs and Africa Agenda 2063. Now, let me quickly start by saying that social protection is now very much on the table. Maybe 20 years ago, it was not so, but now it is an extremely prominent component of national development strategies. And more than, I think, about 1/3 of the African countries do have the social protection strategies. And the reason for that is very simple, is that there is now a lot of evidence as to how social protection contributes to both poverty reduction and reduction of inequality. So the charts that I'm sharing is basically plotting data on the proportion of population that is living below the $2 a day poverty line, and those that have access to or where the countries are spending on social protection as a percentage of the GDP. And as you can see, higher the percentage expenditure on GDP, lower both the poverty and inequality, though it's very clear from the graph on the left-hand side that the relationship with poverty reduction is much clearer and than it is the case with inequality, which means that it takes many more things to reduce inequality. But it definitely, it is clear that social protection is important as a long-term development strategy. But what are the issues now? I think there are a number of issues that surround the rollout of social protection. So firstly, what is included in social protection becomes important. Are we only talking about social assistance, or are we talking about more than just humanitarian or crisis-related social assistance to include social security guarantees and a comprehensive social protection system? Then there is this whole debate between the utilitarian motive of social protection or to provide social protection from a human rights perspective. I'm not going to go into that, but I'm just laying it out that people come to social protection from two different directions. Then there is the issue of coverage. And now this is important because you might have wider coverage, but the component amount reaching the people who need to receive it may be much less. In Africa, about 20% people have coverage of at least one social protection cash benefit, which is actually a very small proportion. The coverage is much higher in the countries in Europe and elsewhere. So there is a clear difference of how we can extend coverage. And so that is an important issue. But the one that we are going to focus on, and that is the focus of today's webinar, is also how the countries can pay for, how can they raise more resources for funding social protection in their respective countries. So that is item number 4 that I've highlighted in this slide. But there are a number of challenges, and in spite of increasing recognition of the importance of social protection, many countries are unable to do that, and especially the key challenge, which is going to be the theme of my presentation, is because of limited financing of social protection. I mean, countries are unable to mobilize adequate resources, and especially in Africa, about 2.8% is the coverage, as it's nearly half of what is the world average. So I'm not going to focus on those are the other challenges, but it's on the limited financing of social protection and that we are talking about today. Okay, now I've I've tried to condense the presentation into 6 ways of mobilizing domestic resources, and I'm going to take you through each one of them by turn, and focus on each one of them. And the first one is, of course, increased tax revenue. 2 is reduce debt burden. 3, reduce illicit financial flows, which is an important, the big issue in Africa. 4 is reallocate budgetary flows and rationalize inefficiencies in subsidies. 5, which is very important for Africa, is earmark revenues from natural resources. And 6 is identify innovative financing mechanisms. And let's see what is the relative importance and of each one of them. In terms of increasing tax revenue, here, if you look at the average in Africa, it's about 19.3, as this visual indicates. 19.3% of GDP is raised through taxes in Africa. Different groups of countries are at different levels. So, of course, if you look at resource-rich versus non-resource-rich, which is very important, the resource-rich countries are able to raise more taxes, so it's about 20.6, not much higher than the average, but still. And as you go by income categories on the right-hand side, you will see that the richer countries are able to generate more tax revenue. But I think what is important is the classification and where the money is being or where the tax is being raised. And I think Gift referred to in his presentation, I think the issue is really that in the lower income countries, there are more indirect sources of tax revenue. And as a result, very often the tax revenue becomes regressive. And unfortunately, the income tax, personal income tax, is very low as a proportion of the total, maybe largely because of the informal nature of the economy. I mean, a large proportion of people are in the informal sector, and they may be below the personal income tax bracket, and as a result of which, most of the tax that the countries do collect, on average 19.3% of the GDP, is coming from indirect sources. Now, this is very interesting. I mean, there is a concept of sin taxes, which has been tried out in some countries, not with much success, but that is something which has a dual benefit. So the taxes on alcohol, tobacco, sugary drinks can increase and do increase government revenues, but at the same time can discourage the consumption of products which are detrimental to one's health, and therefore maybe obviate the need for increased health expenditure later on. So in that sense, I think the sin taxes is something which has been tried out. South Africa has tried out a levy on the sugary drinks, but most countries have not been very successful either. And so Kenya, which has the highest rate of diabetes in sub-Saharan Africa, has faced a lot of resistance and had to withdraw similar sugar tax. So these are the things, the trade-offs and the kind of negotiations that countries have to undertake. So it's not a kind of a smooth flow, because there might be a rationale for having taxes on alcohol, tobacco, and sugary drinks, but then you would meet with a lot of objection and protest whenever you raise taxes. So I think that is just highlighting the difficult nature of raising taxes, whether it is the usual forms or through a different route. Then I think the big issue in Africa is to reduce the debt burden. And a lot of it, about 57% of GDP for most countries, is the debt burden, the public debt that most countries carry, as a result of which the investment, as a result of which they are not able to make the necessary investment in the social sectors. In fact, the data that we have looked at is 20 countries have excessive debt burden in excess of 60%, and in 6 countries it even exceeds 100%. So it's large, and in fact the interest costs, the interest to revenues ratio, even just by paying interest, has increased from 5% to 10% in a short span of 2012 to 2017. In countries like Burundi, Gambia, Ghana, Nigeria, and Zambia, it is in excess of 20%, which really limits the government's ability to use the discretionary resources, the public expenditure, for development purposes and social protection and other social sectors. Okay, just to give you an idea here, which gives the spread of the countries across. We have data for 52 countries, and I put it on a percentage of GDP range, the debt, total debt commitments which countries have. And as you can see, about 36 countries have on average a debt burden in excess of 40% of the GDP. And in fact, 18 of them have above 60%. So in that sense, many countries carry high debt burdens. There is no clear figure as to what would be a satisfactory debt burden, but countries which have access to revenue and they are able to manage their debts, they can even go higher. But then countries which don't have such similar access to revenue would be under a lot of debt stress. And so I think that needs to be managed with and looked at with in the context of the macroeconomic fundamentals of those particular countries. Now, the third one is on reducing illicit financial flows, and this is an important issue for Africa. And if you have looked at the data, in the 10-year period for which we have data, about $300 to $600 billion of capital has left Africa in a 10-year period. So at about $30 to $60 billion per year outflows. And not surprisingly, 90% of this is from the resource-rich countries. But also more than 50% of it is from lower middle income countries. And so in that sense, I think it's important to recognize that the illicit financial flows which is usually through under invoicing and other means, affects almost all countries, and maybe proportionately the lower income countries are much worse off. Though of course the two countries with the largest illicit financial flows is Nigeria and South Africa. Of course, by reducing illicit flows, governments can fund their domestic development expenditure, and we looked at on the health financing, for example. We looked at in 21 countries the amount of money that goes out as illicit financial flows. It's higher than what is needed to provide health access to 90% of the population and move towards universal health coverage. I mean, the amount of money that flows out is more than what is needed to fund health, just one sector that we looked at on health financing. And so by that logic, I mean, by that calculation, if you look at most countries can benefit if we are able to curb the illicit flow of resources from the countries. Okay, then the fourth one is on reallocating budgetary flows and rationalizing subsidies. Now, this is very important. This is important because very often we recognize that we can't raise more resources. As I indicated, increasing taxes is not going to be easy. So then the option becomes to move money from one sector to another. But here also there are some issues that there are not easy. So one of them is that the constraint that arises is a trade-off between the social sector. So if you want to allocate more for social protection, if it is coming from health and education, then it becomes a zero sum. And in fact, people may lose out more by reallocation across the development and the social sector. So it's a huge challenge, and it becomes an important feature as to how the country manages its macroeconomics. But also the fact remains that the other avenue remains that the countries can reduce their fossil fuel subsidies, which very often are not for the benefit of the poorer income households. But unfortunately, that is where the political economy goes. And so therefore, for example, in Egypt, there was an attempt to move the subsidy to reduce the subsidy for fuel, was met with huge resistance. And so in that sense, I think it becomes a big challenge for countries to be able to move money across different sectors. But this is something which is very important, and the countries have to look at as to how to fund the development sectors and the social sectors much more than they are doing at the moment. In Africa in particular, has access to a lot of mining resources, and this is a huge asset. So the resource-rich countries can impose more taxes and may be able to negotiate better terms on which operations have been performed in the past, so as to mobilize more resources. And as we have seen from the graph earlier, the countries are able to mobilize more resources in the resource-rich countries, marginally, but they do more than the continental average. But the real trick is as to how they are being used, and whether those additional resources or natural resources are being used for funding of social protection and the social sectors remains a challenge. And lastly, I'm going to come to innovative financing mechanisms. And here, I think we need to look at how we can mobilize resources from other sectors, from sectors outside the government, that are within the purview of the government. And here, in some countries, innovative financing models such as performance-based financing and development impact bonds and social impact bonds have been tried out, where they mobilize resources from the private sector on the basis of certain results. In fact, in Cameroon, there is what is called a cataract bond, where the private sector is funding and putting money into the government for running the programs for addressing the cataract problem. So I think the same thing can be done for social protection, but these are usually results-oriented funding mechanisms but they combine and bring together resources from public sector, philanthropic organizations, and private sector resources to really finance service delivery. So this is something else which is innovative at the moment. It can be tried out. It has been tried out, but I think it's important that it is scaled up.
Saurabh,
So
sorry to
I'm.
interrupt you. Are you wrapping up now?
Yes, this is the last slide. And so therefore, this is some of the snapshot of the various mechanisms that we have that I have shared with you. And I'll be very happy to respond to any of the questions you might have. Thank you.
Great. Thanks so much, Saurabh, for your presentation, for walking us through options that countries might have to increase the public space, financing space, fiscal space for social assistance. We have several questions, and I would like to now turn to those, and I'll read them, and then I'll assign them in my role as a moderator to one of you. So let me start with the first question, which is quite general. What is the outlook of social protection likely to be after COVID-19? From Joseph Ower, thank you for this question. Perhaps very briefly, I would like to hear from both of you. We already have seen and heard that the momentum the social protection in general has gained on incredible momentum. But what does it mean for Africa post-COVID-19? Is there a chance for increasing political commitment, financing, institutions, and rights-based social assistance post-COVID? Gift. What's your take on
it? Yes. I think it has provided a lesson, I must say, that we countries in Africa need to respond and do so using domestic resources, because we may always face crises that are global, and global partners may not be able to assist. So it's a good lesson. Again, also moving forward, it gives a chance for African countries to create social registries of beneficiaries. So as they do so now in trying to reach out to people who are in need, they're already creating a registry that they can use in the future for institutionalizing social assistance. Thank you.
Thank you, Saurabh. Any quick thoughts, but really very brief, because we have coming questions. Now we have 8 questions and we have 15 minutes time.
Okay. Yes, very quickly. I think there is a huge recognition of the importance of social protection because of the COVID-19 now. But there are 2 parts to it. One is the immediate response, which is very important. But also we need to use this crisis as an opportunity to set up systems for addressing any future shocks and future adverse shocks. And I think that becomes very important, that we need to respond quickly to it, but also need to set up systems which can support and increase the coverage of social protection to a large proportion of the population. And here the key challenge would be if we can extend the social protection to the informal sector workers, because informal economy is such a large proportion in Africa.
Yeah, great, thanks very much. The other question, question number 2 from Kennedy Ower, it will be gift for you to perhaps to answer. We saw the graph where you showed us that Tunisia, Seychelles, and South Africa are doing much better than the other countries in terms of spending on social assistance. Could you quick comment on how is that in your view? Why is that in your view?
No, thank you. That's a bit difficult question because it involves also political will. But in the short space of time, I'll quickly maybe say that they have institutionalized social assistance to an extent that it is always budgeted for. You have an agency that is running this whole thing. So in a way, as budgeting processes take place, everyone knows that we need to budget for social assistance. So institutionalizing is the first and foremost answer. Look at South Africa specifically. Social assistance has a century, running, and one cannot just take it out. So I think institutionalizing it is my foremost answer ahead of everything. Thanks.
The other question we have is about countries who are in conflict, and thanks for your question. Our report actually has not looked at humanitarian aid, but since we were interested in institutions and in the sort of normal context, but this is a very valid question. What could some of the options for countries on the continent that are experiencing ongoing conflict, whereby the state running social protection program is party to the conflict and as a result will clearly not target the vulnerable populations on the opposition side? Yeah, so I don't know who would like to take this question, perhaps Saurabh. Do you have comment?
Yes, you're right. We have not specifically looked at countries in conflict, and so I would be hesitant to answer directly this question of how to extend this in conflict, because unfortunately the biggest paradox of social protection, I think in most places, and particularly in Africa, is that the countries that need it the most have the least access to it, both in terms of coverage and the amount of benefit that can be provided. But yes, I think it is very urgently required in countries of conflict, but then it becomes an issue as to what extent is it sustainable, and what extent the impact can be sustainable. So that becomes an issue. Unless Gift wants to add to this.
I think you have answered Saurabh on that one. I will skip.
Great. And of course, the issue of politicizing the aid and social transfers is a very tricky one, and we have not discussed that in particular in this report. Coming to the question from Natalie Klein, and this one will be for Saurabh. Question number 4. One challenge we face is that minimum wages in most West and Central African countries are so low that it prevents governments to deliver transfers with appropriate amounts to effectively impact poverty. Social assistance is designed to be life-saving assistance and then seen as burden, not an investment. A vicious circle. It requires political will and courage to make the move to actual large-scale appropriate programs, and donors partners do not always help. In countries with strong social protection systems like France, government debt is beyond 100%. So is that really a relevant indicator to assess social assistance performance? Thanks for your comment, Natalie, and over to you, Saurabh.
No, I agree. The amount is very low. So not only is the coverage very low, the amount of transfer is very low. So that is correct. In fact, one of the issues that we need to see alongside social protection transfers is the structural nature of poverty. In Africa, nearly a quarter of Africa's population, 22% of the poor, of the population consumes less than not $1.90 but $1.14. So that is they're 40% below the poverty threshold. And so this small amount of social protection benefit that reaches them may not be able to make much of an impact, have much of an impact. And the other figure to remember is also the level of working poverty that we have in Africa. And I think here it is very important, the working poor. There's a very large proportion of the people who are classified as working poor, and they, in spite of working at a very low wages and low earnings, are unable to get out of poverty. So in that sense, you're right, absolutely right. I agree with you that it is very low. The only point I would want to raise here is that ministries of finance always try, and the policymakers always try to balance the amount of benefit with the incentive to work. And I think this thing, there has been no final resolution of this issue as to whether social protection benefits suppress your incentive to take up work and work, because if you are of the working age, then the only social protection you should be getting is a contributory form and not non-contributory handout from the government. And I think these issues are not resolved, but they're very much there, and I think they need to be addressed and looked at together.
Thank you. Now we have several questions on the informal workers and their need for coverage. So perhaps I cluster them and ask for your thoughts. The first question is from Fabio. Hi, Fabio. Thanks for joining. And excuse me 1 second. The first question is from Fabio, and he's asking whether subsidized social insurance for informal workers could be an alternative to decrease the need of social assistance in Africa. And the question is, what has been the experience of countries that have tried these schemes? Quickly, from my side, we've been actually looking at different models of the extension of social assistance to cover the informal workers. And there are some emerging interesting innovations from both public and public-private partnerships that need to be studied a little bit more. But definitely this is a population that is now really coming to the fore in terms of their needs and in terms of their vulnerabilities, and that needs to be addressed. That's a quick question from me, but let me go. So the first question on informality is whether subsidized social insurance could be an option. The second question on informality is following up on this question and it's from Diane Karenzi Muhogarva. Sorry if I mispronounced the name. With high proportions of informal sector, sorry, I lost the question. Here it is. With high proportion of the informal sector in our countries, there are limitations in terms of objective and fair targeting and assistance to the vulnerable, which much affects the effectiveness of social protection strategies. Any insight on this? So I think in general, if I could ask perhaps Gift, if you have some insights on that. First, whether we should think about some models like subsidies for informal sector, and secondly, the issue perhaps that is important now is that the people in the informal sector very difficult to target, even if we want to get the assistance to them, because they're undocumented, not necessarily undocumented, but they're not part of any registries or any lists that the government has for social assistance. Any thoughts on that?
Yeah, quick thoughts. So we have about 80% informality in Africa, and most of these are not covered by any form of social protection. So that's the first thing. Those who are covered are still undercovered, and they are not even in the formal sector. They are children and they are old aged, so we need them covered. Now, how do we do it now to extend to the informal? I think what Fiber is saying makes sense in that in the informal sector, we know they are making a living, they're making money. And so if they can contribute and they are subsidized, it may make sense so that they may have social insurance and they get a cover. There are good examples that are coming up, like we know Ghana, for instance, has a health insurance that is sort of subsidized. In Tanzania, there's a community health fund. I'm not so sure whether it's still operating now, where if a community-based organization will save, let's say $100, the government will then top up by 100%. So there are those schemes that may come up in the informal sector, and it really makes sense that they do happen. Thank you, Renata.
Thank you. Let me now pick some other, and try to cluster the questions because they're coming up, which is great, but also our time is nearing the end. So I just want to assure everyone that even if we don't answer the question now, we'll try to get back to those questions and post them online on the webinars page. One question which I thought is quite interesting. Let me see. There is one question about the humanitarian actors that mobilize funds for COVID-19. I think this is not precisely the topic of our webinar. That's the question from Zainab, so my apologies, but we will not ask our panelists to answer that. There is an interesting question about from Kennedy about corruption and how this undermines the ability to finance social assistance. Saurabh, would you have some comments on that?
On corruption?
Yes.
Well, that is going to be a difficult task because we didn't look at it directly, but I thought by referring to illicit financial flows, I was actually alluding to corrupt practices. So I think, yes, it does reduce the amount of resources that can be available for countries to allocate for social sector spending. And I think we have looked at the numbers, and as I was sharing, sometimes the amount of illicit financial flows far exceeds the amount that is needed to extend social protection coverage to a large proportion of people in the country. So I think definitely corruption has a major role. It is really an issue of how it manifests itself. So for example, in countries, it manifests itself as through illicit financial flows, and that is what we have been able to capture. I'm sure that is not the only way it manifests itself. So you're absolutely right, but we don't have the data really beyond what we shared. Though, of course, it is very much needed that we should be able to focus on improved governance, which is very important. Renata?
Thank you, Saurabh. The question from Jacob Nyamazawa is about how countries with high investment in social protection are financing it. So just to, I'll invite Gift to answer, but as Gift was saying before, one of the success factors is very much the institutionalizing of budgets and having that as part of the welfare architecture. But perhaps, Gift, you could add on specific countries if you remember the data. I don't know if you looked into, breakdown of financing for social protection and what was behind it, whether specific taxes or any other instruments.
Thank you, Renata. So definitely the countries that are financing social protection in Africa, that are financing it well, they use domestic resources. So it's mostly tax revenues. By the way, I showed that in Africa we've got a high share of indirect taxes, and if this is to be spent, and if it is addressed to the poor, it can sort of really be a bigger chunk. So it's a matter of also priorities here. Thank you, Renata.
Great. There's one interesting suggestion and comment from Alexis Bigger, WHO. Thanks a lot for the presentations. Based on the framework proposed and taking into consideration the lessons we're learning from the pandemic, my suggestion would be to look at the subject at micro level on basic needs being covered, not money being available. At meso level, the redistribution mechanism, not only public programs, but also social redistribution. And at macro level, not the money in social related budgets, but in countries' basic needs resilience budget. Thoughts on that? And perhaps I'd like to ask Saurabh.
I think, I mean, sorry, there was a gap in communication in between. Can you quickly summarize this question? I'm so sorry, there was a gap in.
Yes. Do you see questions? It's question number 11 in your chat. It's
Okay.
really a suggestion, but if you have any thoughts you would like to share.
Okay. I'm opening the chat. Yes. Okay. Yes, at the micro level, yes, I think that's very important. I think the three levels have to move together, and this is what comes out from the framework that Gift presented about the micro, the meso, and the macro. The three have to work together really for the resources to be available. But I think most importantly, what is coming out is the targeting of it. I mean, how are we able to reach out to the vulnerable groups? I think that's becoming very important. And there is this whole thing of whether we should have a universal kind of a social protection floor, which has been a UN thing for a very long time now, a basic sort of guarantee for some basic services to almost the entire population, or whether we should target resources to those who need it. And I think there is that issue, and different countries handle it differently. So Nigeria and Mauritania, for example, I know have launched huge sort of systems by which they are identifying the people who need it the most, especially the most vulnerable women, and they're targeting the resources there so as to optimize the use of the limited amount of money that is available. So I think that is usually a balance that needs to be undertaken. But I think what is the last point that I want to say is that on this is very important is that for a universal social protection floor, the amount of money needed at the end of the day is not huge. I mean, it is about 3 to 4% of GDP, maximum 5% of GDP, and which is far less than the resources that might be misallocated for other sectors. So I think if the governments are very serious about it, and there is a requisite sort of political will behind this, money can be found from national budgets.
Great. We are running a bit out of time, and I know, Saurabh, that you have to go to another meeting. There are two more questions, and perhaps very quickly, and then we'll wrap up. The question for you, this is a question on illicit financial flows, and question from Sergio is, how can they become the state, how can they be transformed into state budget revenues? And there was an earlier question about the illicit financial flows, whether it's really realistic to think that they could become a sort of permanent fixture of a sustainable budget for social protection.
I mean, both questions are very valid questions, but they are extremely difficult to answer. And the reason for that is, in fact, Sergei's question is that how can these flows be transformed into state budget revenues? I mean, it really depends on how keen governments are to tighten the systems. In fact, for example, I know from personal example is that when the new government came in Nigeria, it really strengthened the foreign exchange system within the country, because the difference between the exchange rates was huge, about nearly double the market rate and the formal exchange rate, and therefore there was so much of volatility, and therefore the resources were not going through the government exchequer. And I think those are the kind of measures that governments need to take, and it really depends on and comes down to how serious they are in things. But very often the political economy questions do come up, and the whole question of which groups are stronger within the governments and which groups are able to lobby their way through makes a difference. But yes, I agree. I mean, these need to be transformed into state budget revenues. How they can be done, I think the governments will have to answer those questions themselves.
Thank you. And perhaps the last question, or rather comment from Gabriel Fernandez, it's about having legislation and guarantees that would entitle people to social transfers and identify leading institutions. And this is exactly the topic of our next webinar, which will look critically at legal frameworks in Africa. And we have found that most of social assistance provision is still discretionary. It's not rights-based, so there is a lot of work in this regard. But thank you for that comment, because that indeed is making social assistance part of the institutions and something that people can claim and treat as an entitlement. So that seminar is actually on June 4th. I invite all of you to join us. I know that there are a couple more comments that we could not respond to. One is on HIV and AIDS, and people and sex workers, people who are vulnerable currently in the crisis. Of course, this could be like a very, very big and additional discussion. We probably don't have time to address it, but we recognize the needs of different groups who are completely outside of the social assistance system currently. As Saurabh mentioned, only around 20% at the higher end are covered by any form of social protection in Africa. So the needs are indeed great. But with that, I would like to thank everyone. Thank you so much for tuning in to our webinar. Thank you to Gift and Saurabh very much for your presentations and staying a little bit over the time. Thank you to Karini and socialprotection.org for helping us organize the webinar, and also to my colleague Leah for assistance in organizing this webinar. And have a great day, and we invite you to the next one, also on socialprotection.org. Thank you.
Thank you.
Bye now.